Hello and welcome to the Art of Being Human. During these last few weeks I've been talking about suicidology, and last segment I started going through some clues and cues that people leave when they're thinking about suicide. Sometimes they know that they're leaving these clues and cues, but sometimes they don't know either. And so it's important to pick up on what they are if you want to help somebody who you think may be going into a suicidal crisis. So I started with that. I didn't finish with it. I want to continue with that today and add more information. So let's turn to this chart. I talked about verbal cues, direct cues. I'm going to kill myself, which is rare. You usually don't see that because people are usually not that open and honest about telling other people what they're planning. You get the indirect clue, you'd be better off without me, statements such as that, I want to go away and never come back, all kinds of statements like that that I went over last week, and that's more common. And then you have nonverbal cues. Some of these we have gone over, some of these we have not. Poor sleeping habits may be a clue if the person does not have a medical issue that would cause that to happen. Changes in eating can be a clue, eating too much or not eating at all. Giving things away is actually quite a strong clue if there's no reason that you can think of why a person would give something away. And they give away a lot of things that are important to them because they want them taken care of after they're gone, because they're attached to them. Making a will is tying ends together so that if they do die, if they make a successful attempt at suicide, everything is in place for people to go and live their lives after they're gone. Let's see, changes in personal habits, anything that's very unusual that you don't normally see of a person, that can be a clue too. But as I've said before, you can't take any one of these things and assume a person is suicidal on the basis of that one thing. What you have to do is take a group of those things acting together. Then you get some kind of an idea that the person may be in a suicidal crisis, and talking to them about it is actually a good thing because you're not causing them to do it, but you're letting them know you're there for them, that you want to help them, and they can feel sometimes a great deal of relief just knowing that somebody else knows and will try to get them help. Of course, there are some people who don't leave clues and they don't leave cues, and you just never know, and they commit suicide and you're left wondering why. There is such a thing as a psychological autopsy, and this occurs after a death by suicide of psychologists getting together and studying the person's life to figure out why they would have done it and not let anybody know what would have led to it. You know, they do that too for people who commit crimes and people who go into like shopping malls and shoot everybody up. This has been happening lately. And why do they do it? Why would they go into a post office, or why would they go into a mall where there are a lot of people and just start shooting anybody? You know, why are they so angry about things, and how can we stop it? So these psychological autopsies can be quite important. Now, we're here in terms of changes in behavior, and that's what I want to go into next. They can be clues and they can be cues to an upcoming suicide. Increases in accidents. Some people get into accidents deliberately. They want to get into accidents because they want to hurt themselves or they want to kill themselves in an accident. They don't want people left behind to think it was a suicide. They want people left behind to think that it was an accident that they didn't have control over, and it's too bad that they died, and then of course the insurance will kick in. So more accidents, and sometimes these are what's called suicide motions. A suicide motion is when a person starts to practice suicide a little bit. Now Sylvia Plath, I'm going to give her as an example, excuse me. Sylvia Plath was a poet, and she did end up by killing herself, but she practiced it. She would sit in a bathtub, cut herself and see the blood go down the drain of the bathtub. She must have cut herself pretty badly to see all of that, but it was practicing. How would it feel to kill themselves? What if you sat and you put your hands around your neck and tried to choke yourself? What would it feel like? They're called suicide moves. They're really practice moves for a person to find out how bad would it be, what would the experience be like. And I think, you know, some suicides, it's accidental. They think they're practicing suicides, and they don't really want to kill themselves at that point. They're just kind of considering it. But they can kill themselves by accident. And if they kill themselves by accident, it still is suicide. But it wasn't an intentional suicide, and so it's deemed to be an accidental suicide. A lot of people, in terms of behavioral changes, will start to withdraw. They won't go out with people. They won't do the usual things that they like to do. They don't want people to see them. They'll stay away from shopping. They'll stay away from their friends. They'll stay away from dinner parties. All the things that they usually do that's fun, they just completely withdraw from life. They want to be isolated. They want to be by themselves. Why would they want to be isolated and by themselves? Well, they want to think about their upcoming death and what it means. So they stay by themselves. Now, some people don't have a lot of friends, so they're not out a lot anyway. But when you really see that this is a change of behavior, is that normally they're with people, normally they're doing things that they like, and suddenly they stop. They're thinking about themselves deeply. That's why it's so important to make contact with people and to get them out of wherever they are. Get them out of their private space, their little cocoon, their little box, you know. Get them out of that and let them see life again. And that kind of helps reintegrate them in with other people and the way they used to be. But some of them will withdraw. They want isolation. They want to be by themselves. I suppose if you're thinking about the end of your life, what do you want to do? You want to be alone to think about that. What does it mean? What is it going to be like? Who's going to be left behind? How are they going to fare? Although actually suicide can be a very selfish thing to do because they're thinking only in terms of their own needs and their own experiences, and they're not considering what it's going to do to their families. One of the things I always used to do if I had somebody I was counseling and they became suicidal is I tried to confront them about what life would be like for the people that would not have them around anymore. What would life be like for their families? What about their children? What about their wife or husband? What about their parents? What about their pets? You know, what about everybody suffers? When somebody kills themselves, everybody suffers. It's not just the person who dies. The person who dies, their life is over. But the people who are left have to cope with it. And it can be a very, very intensive grief process. And I'm going to be later on talking about the grief of suicide. I've gone over grief, but I want to go over grief in terms of suicide. It's different. It's more intense. It's harder to deal with because there is a sense of guilt. I didn't stop them from killing themselves, so therefore it's my fault. I could have done more. I could have picked up on more of things that they said. And so it becomes a very, very complicated grief process. And never should anyone blame themselves if one of their friends commits suicide. It's not their fault. The person makes their own decision to kill themselves. And when they do it, everybody else is so willing to take the blame because they keep thinking, oh, what could I have done to have changed it? What could I have done to help? But the thing is, sometimes you don't even know because they're not being forthcoming and they're not telling you. Or if they are telling you, you're missing the signals. But you're just a human being. You can't help it if you sometimes miss people's signals. How are you to know everything? You know, you can't know everything. So don't blame yourself. But they want to be isolated. The other thing, it's hard for them to concentrate. What are they concentrating on? Their upcoming death. That's all they can think of. I suppose if you were about to get married or have something happen to you that was just very important to you, you'd be thinking about that all the time. If you were to take a trip, I can remember, I've been to the Holy Land a number of times, so I can remember before I went to the Holy Land, I'd be thinking about the trip, preparing for it, packing for it, making sure I had camera equipment for it. What should I take? What should I wear? What's the weather going to be like in Tel Aviv where I land? What should I bring a winter coat? Is it going to be cold? Is it warm? And all of my thoughts are around the fact that I'm taking this very important trip. And it's a healthy thing. But on the other hand, if a person were thinking about dying, that might be unhealthy. Certainly if it's suicide, it would be unhealthy. But they're gearing themselves up for it, and that's what they're thinking about all the time. Just like I'm thinking about packing for a trip, they're thinking about parting company with everything that they have ever known. And so you get caught up in the thought process of something that's intense. And when do you think about it the most? When you're isolated, when you're by yourself. So the symptoms of withdrawal and isolation are not uncommon to a person who is thinking about suicide. There would be other noticeable changes in behavior that you might notice about a person who is thinking about suicide. What you have to do is know that person and what's typical for that person. And what's not typical for the person, then you start to hone in on what's going on. You're acting differently. You look different. You're dressing different. You're not eating as much. You're not sleeping as well. What's wrong? What's going on? Tell me what's happening. That would be a normal question to ask. I've noticed changes in you and I don't understand the changes and I'm concerned about you because I like you and you're a friend of mine. Is there anything I can do to help? Tell me what's happening. You open the person up. You give them a chance to talk to you. And if they mention, well, I've been diagnosed with an illness, it's not going to get better, and I'm thinking about taking my life. They might actually say that. Or I'm just concerned about the things that are happening to me physically. I'm not feeling well. I don't know what happens next. You take them to a doctor. You don't just send them. You go with them to make sure they get there. And they will refer. The best way to get a referral, I guess, to a psychiatrist would be to take them to their doctor, their family doctor, and let the family doctor make a referral. Because the family doctor is going to know the patient, they're going to have seen him, they know what the medical conditions are, they know what kind of personality the person has, they know how they respond to stress because they've discussed it in the office before with other medical conditions. And then they can make a referral to a psychiatrist. If a doctor makes a referral to the psychiatrist, then the psychiatrist is more apt to see the person quickly than if an ordinary person who's not a doctor makes a referral. A professional person making a referral is a lot more important, or is treated a lot more important than a person who's not a professional making an appointment. When people saw me, I could make a referral to a professional, to a doctor, or to a psychiatrist, but I was already a professional. So when they saw me, I would simply call some of my psychiatrist friends, and I'd get permission, of course, to do this, and say, I've got somebody that I'm seeing that needs to have a psychiatrist. Will you be able to see them? A doctor can get a person in to see a psychiatrist faster than a person who's not in the medical field. The other thing you can always do in an emergency is take the person to the emergency room and tell them this person is suicidal. And then they have people on call. They have counseling centers where staff members are on call to talk to the person about it, and then they can make a referral to the psychiatrist. In the end, a person needs to have professional help. Sometimes they can get over it by themselves, but they really need professional help. Then they have the resources, they are able to prescribe the right medications to help the person feel better and get them out of a depression. They can put them in group therapy where they talk to other people who have similar problems, such as AA, Alcoholics Anonymous. So it's always wise to get a professional viewpoint. And if you know somebody that you suspect is suicidal, take them to their doctor or go with them or make sure that they get there somehow. Let the doctor make a referral or take them to the emergency room of the hospital, and they will make sure that the person gets professional help because they have people on staff that will do it, and they can make referrals as well. So the basic thing that you want to do is save a person's life if you are thinking that they are in trouble, and if it turns out that they really are in trouble. Now, environmental changes, loss of job is a big one. And you know, we have an economy where a lot of people have lost their jobs, and everybody says, oh, it's improving, oh, it's improving. I think for a certain segment of the population it's improving, but it's not improving if you don't have a job and you need one and you want one. So it's not improving for everybody. The recovery of our recession, and I guess it's not a depression, but it sure has felt like that. This is important. You need to have a recovery of that. Loss of job, economic changes where you can't get a job in your field, so you've got to get a job somewhere else. You end up by working in a fast food place when you're really an engineer. That's all discouraging, but it may be the only job that you can get is a job that's not in your field and does not make use of the information and the skills that you've gained from your college education. Poor health is important. That can lead to people being suicidal. Failing courses, or doing well in courses but you fail one, or you get a bad grade in one. Some people, when they do extremely well, they may miss on one thing, and then they consider themselves to be a total failure. That's all or nothing thinking, something that's called all or nothing thinking. You either are wonderful or you're awful, and there's no gray. It's either white or it's black, and there's no gray between. And there's nobody that's so great that they don't have a miscue somewhere. You know, so you can get, like I remember one semester I had an all A average, but except for one class, so I can't say an all A average. I got the psychologist that I took a course from, and I liked him. We were personal friends. He gave me a B+++++, but he wouldn't give me an A-, which would have given me a 4.0, an all A average. He said it was a B++++, because I did so well, but not exactly well enough to get an A. So he ruined my 4.0 average and gave me a 3.9 average. Well, that's not a big deal. That's still a good average. I was not discouraged by that, although I didn't quite understand his reasoning. But for some people, that would have been a depressive event because they're aiming for all A's, they're about to get all A's, and they miss one course so they don't get the A. Now, for me, that's life. You know, it's not a big deal. But for some people, that would be a disastrous blow because they were so hooked on getting all A's that they couldn't stand the possibility of getting anything less. So if you have a student that's doing extremely well, and then somehow something happens and they don't really fall, they don't really fail, but something happens in one area of their life, so it's not all perfect, then they feel like a total failure. They're either got to be a total success or a total failure. They don't have any room for movement in any direction except you win or you lose. You're in or you're out, you know, and that's not the way to look at life, but a lot of people do look at life like that. Win or lose, you know, just being terrific or not being terrific. There's no room in between, and that's not the way to look at life. So, poor health will do it, failing courses will do it, family conflicts will do it, sudden changes that you cannot adapt to. You had a wonderful job, the company closed, now you don't have a job. You used to be able to pay all your bills, but now you can't because you're without a job, but you used to have a terrific job and it's no more. You can see how all of these things acting together could possibly make a person to be suicidal. And I want to just show you this chart. A person is more likely to do it if they are sad, old, lonely, ill, or drunk. Depressed people are more apt to do it, And we're finding a great upsurge in the number of suicides among elderly people. And the reason for that is if they have a diagnosis such as Alzheimer's or something, they do not want to burden their families. They want to get rid of their lives so that they don't act as a burden to the other family members. I think it's a big mistake because God creates life. We don't have the right to decide when we live or die. That's not up to us. Being lonely can do it because a person may feel they have no friends. Being sick can do it because people feel that they may not get well. And people who are drunk and have alcohol problems and drug problems are more likely to do it anyway. So these things, sad, old, lonely, ill, drunk, solid, these people are more apt to do it. So I want to just remind you of the fact that suicide is a selfish behavior. It's manipulative, it's selfish. I'm not saying that I don't have sympathy for people who have all these problems, but what they don't stop to think is the fact that they're on earth for a purpose. There's a reason for everybody to be here and a function that everybody has. And even if you're ill, that doesn't mean you're not important. See, people tend to think of either they're important or they're not important. Either they have a promise or they don't have promise. It's a part of that all or nothing thinking that I mentioned before. But I think that everybody is of value. Everybody's here for a purpose. And if people would stop to think of how their death would affect other people in their lives, people who care for them, people who want them around, people who aren't judging them on the basis of their health or their finances, but they want them around because they like them. They're good people. You see, it can be selfish, it can be manipulative, it can be a rational act. It also can be due to mental illness, and there are different conditions that lend itself to it. They can learn suicide as a coping mechanism because they know of other people in their family that have done it, so it becomes more commonplace. So there's an awful lot to consider, but what my focus is on is saving them, because if they're saved, then they've got more life to enjoy. They can always get help for their medical problems, and it's just important to have people have life, you know, to extend the life, to help them as much as you can. So we're out of time. I'm going to close it here, and next time I'm going to go into intervening and how to do that. I kind of expected to do it this time, but we ran out of time, so we'll continue next time with that. Please join me then.